President's Blue Cross and the finance chair of the Democratic National Convention Host Committee, Daniel Hilferty. Also with us, former White House advisor for health policy, vice provost for global initiatives at the University of Pennsylvania, Dr. Emanuel. Good to have you.
So Dan,
Dan's been here.
Dan has been here. Dan, healthcare is not as big of an issue in this campaign as, say, it was in 08 or 12. Should it be?
Well, Joe, it's interesting. I heard you talk about that earlier today. It should be a bigger issue, and I think once the election's over, it definitely will be a big issue. 18% of gross domestic product dedicated to healthcare. Still, although we've increased the rolls by 20 million people, there's a lot more to be done in terms of giving people access to care. So just the sheer cost of it will mean that it'll be a big topic post-election, right, and I think going up to the election.
And Zeke, I know you certainly are a big supporter of the Affordable Care Act, but even you admit there have been some real bumps in the road and some real challenges ahead. What are some of the main challenges as some insurance companies start to pull away from this program?
We need additional work on the exchanges, undoubtedly, making sure that the risk adjustment is right. I think drug costs are going to be a big issue. They're not going away. I think drug costs probably will raise their head in the fall election, what to do about it. So I think there's that. But I agree with Dan. You know, it's less an election year, but it is a governing issue. Whoever's in the White House is going to have to keep pressure on costs to stay down, but also improve the quality and consistency. Too.
I just wonder why it's not, though, Joe, when you think about it. I understand the program needs a lot of work, but tell me what president, who thought this could get accomplished?
Well, the thing is, it's still, we don't know how it ends. We don't know the story ends. It's still sort of... No, it's still on a shakedown cruise. I'm not saying that it's going
away. But it's
away.
institutionalized.
But
5 years in.
But Zeke, that doesn't mean, and you know it doesn't mean, we don't know where it ends up. Healthcare itself is radically changing right now. It used to always be fee for services, but Dan, now we're moving from quantity, where let's get them in and out.
He's got the rhetoric.
To quality, and we're also talking more to value. And how do you get more value without spending trillions and trillions of dollars?
So, Joe, let's take a step back and look at the Affordable Care Act. The good things are, as Mika said, 20 million more people are insured. Still about 20 million plus more million that we have to insure. But the truth of the matter is, we're moving towards a value-based system where we pay for quality, we pay for outcomes. In order to get there, you need to have a transparent exchange of data between the payer, the provider, and government, and use that data to have everything out in front, from costs to outcomes on every procedure.
And we have, and I can say this as a Republican, as a small government conservative, we have to have transparency on costs. We can't have people continuing to go in, getting procedures, thinking it's for free, and then finding out that the end result bankrupts the healthcare system, bankrupts America.
Joe, two points. First, this is an area of bipartisan agreement, transparency issue, and I think we will be able to get some progress on that. The second thing I would say about healthcare is, at 18% of GDP, it's always going to be a work in progress. We're always going to be trying to fix it. We're always going to be trying to keep the cost down and get the quality up and make sure everyone gets the right care. It doesn't end. But the Affordable Care Act has done a great job in terms of setting a framework. They're thinking about it in terms of new terms, value. The healthcare doctors are thinking about it in new terms. We've actually got moderating in costs. I know people don't feel it because of the drug costs, but we have had some moderation in costs. It's been a pretty good success.
Mike.
So Dan, 5 years in, which area needs to be tuned up? What's the priority for tuning it up, the patient end or the doctor end?
I think it's both. And Mike, let's talk about the patient end for a second. It's an incumbent upon us on the payer side, incumbent on government, incumbent on the provider side to make sure we get real-time information in a way that a consumer can understand it and use it either to maintain their health or get the help they need, whether it's a general practitioner or some specialty. So it's all about getting information in people's hands that helps them take control of their own life. That's on the patient side. On the payer and the provider side, it's about how we contract, how we interact with each other, and it's got to be based on value. It's got to be transparency around drug costs, transparency around outcomes on every single procedure.
All right, should we drink to that?
Let's drink to that.
That's a lifestyle
Yes, I'm sorry. Yes.
But as a Philly guy,
Yeah.
how about this Philly welcome?
I
weekend?
know. Emanuel, thank you very much. Great to have you. Coming up tomorrow, our exclusive interview with Vice President Joe Biden. Up next, what, if anything, did we learn today?